Welcome, everybody, to the Intersection Podcast. The Intersection is a project of the Robert Wood Johnson Foundation. It's a space for advocacy and healthcare leaders to talk to each other and share about how they're trying to build anti-racist healthcare systems. You can find us online at meetattheintersection.org. I am Anton Gunn, and I'm honored to be joined today by three guests who all work to advance anti-racism in healthcare systems in different capacities. Donna Good-Ledbetter is the Director of Equity at the West Marion Community Forum in McDowell County, North Carolina. Deborah Grimes is the Senior Vice President and Chief Diversity Officer at Ochsner Health in New Orleans. And Joe Locke is the President and CEO of the Eastern Iowa Health Center, a federally qualified health center in Cedar Rapids. And we just had an event a little bit ago where we talked a lot about how to engage CEOs around the issue of equity, anti-racism, et cetera. There was a lot of engagement there, and we got a lot of questions, challenges that people are feeling and dealing with. We know that we want CEOs to do things because it's the right thing to do. And so a question was asked, does making a business case for equity help us get CEOs and leaders invested on this whole conversation around equity and anti-racism?
Well, Anton, I'll be happy to start. This is Joe. I will tell you that my CFO and I play a little game. And the game is, okay, if you want to spend money on this, then what are we going to give up? Or how are we going to generate revenue to offset the cost, right? And I appreciate that because I'm always like, let's do it. And he's always like, hang on, let's have a process. And so we really started this journey with a $25,000 grant from the Community Foundation. We needed that seed money to start off and to get things rolling. So that was about 5 months to use that $25,000. And then we put it in the next fiscal year budget. By the third year, it was a 6-figure item. We call it JEDI-B. We evolved from DEI, and now we call it JEDI-B for Justice, Equity, Diversity, Inclusion, and Belonging. And now that we're several years in, it's a 6-figure commitment. And it's just part of our culture because it serves our patients. And that's what's important.
Deborah, you're in a very large healthcare system. Budgets and economics are everything dealing with large populations. So talk about, does the business case help? Give me some sense of what's the best way to hold people to account to their commitment around equity and diversity in your experience?
Absolutely. CEOs, you do need to connect and use language that resonates with CEOs. And I've never met a CEO that ROI was not in their vocabulary. And I think it shows that you understand the business. So no mission, no margin is true. This is not free activity. And then you create a strategy, though, to get those ROIs. Very tangible things that this work absolutely impacts. I would start with regulatory. There's a regulatory Joint Commission requirements, CMS requirements. It is going to be tied to just staying in business. So it's no longer optional. So that's one thing. The second thing is if you don't do this work and you start to have horrible outcomes like readmission, that is costing you money, because CMS is not going to pay for it. And then there's other tangible things, like doing this work is purpose-driven work, and it will attract really smart people to come work for you. It will also allow you to have increased engagement, retention. All of those things come with ROIs. And so you need to understand just how the business is ran and what's important in terms of outcomes, and then directly draw a line to how you are impacting those outcomes. And there's a cost to that, and that's the ROI. Increasing trust with the community means what? You're going to get more patients to want to come. And so that is increasing what? Your volumes, which increases your bottom line. So there is very much a business-driven process to this. So I think you start at a high level, you attach it to mission, values, passion, and purpose-driven work, but you also need to use language, business-driven work. And you can do both of those.
Very good. So, Donna, you're the community voice on this podcast, representing a community-based organization. You mentioned that your stories are important. Is there a business story that you tell, if any, or how have you connected what you do in the work that you're advancing around outcomes for everybody in the community to the language that matters to the leadership inside of the organization?
I don't think we so much have a business story coming through it from the community lens. I think the people should come first. Because if you're taking money for DEI initiatives and you're not really committed to it, you're just taking the money so you have the money. And I have an issue with that. And I know it takes money to run these organizations, but the people that you're trying to reach, usually they don't have the money to come and receive the services that they need. So that's why we have disparities, because it's not affordable for some folks. My business pitch would be to try to find ways to make healthcare more accessible and more affordable for the people that need it the most, and then we'll have greater outcomes.
Very good. Well, I mean, that's an important perspective that we definitely need to maintain. Now, there's a couple other questions that came in as we were involved in the intersection event that we had earlier. This one was specifically for Joe, but I really want to get both Deborah and Donna's perspective about it, given that they both are doing this work in regions of the country where sometimes the words DEI or justice, all of those things have become bad words or dirty words. So Joe, starting with you, in the face of all of the anti-DEI laws, how are you navigating your JEDI B work? Are you concerned about what impact this might have on you as a leader for your organization or the work that you're doing so well in your community?
The short answer is yes. It's being impacted. And I'll give you a specific example. So the Iowa legislature just adjourned its general legislative session about 3 weeks ago. And without getting too political, a law was passed that the 3 state universities in Iowa, they shall no longer be funding any diversity, equity, and inclusion work at all. And so those offices have been dismantled. Those people have either been reassigned or lost their jobs. And so it's certainly happening. It's certainly happening here. I will tell you that when I moved here in 2001, so a long time ago at this point, Iowa was bright blue and now it's bright red, and things have changed. That's not a commentary on politics. That's just a fact. When the legislature takes this up and says, you shall not fund at a state level things that are coming out of taxpayers' money that are funding these state universities, then that's very impactful in a lot of different ways.
How are you responding? So what is your approach to deal with that as a leader?
So very specifically, not only myself, but other colleagues from federally qualified health centers around the state, we lobby at the state level, we lobby at the federal level. You know, it's really interesting because the way that we provide healthcare, we can do so. I mean, Republicans love federally qualified health centers because we can provide care for 21 cents on the dollar compared to other healthcare. Democrats love us because if somebody can't pay for their services, we treat them anyway. And we have excellent health outcomes. And so, you know, we have broad respect and understanding on both sides of the aisle, whether at the state level or the federal level. And so we have their ear because they know that we're effective. And yet we were very ineffective in getting this legislation changed because the one side of the aisle has a supermajority in the House and the Senate and the governor's office. And so they were able to get this passed with 100% of Democrats voting against it.
Wow. So Donna, can you talk to us a little bit about the environment in North Carolina and how are you responding to it and what are other organizations doing?
We're in the Bible Belt, so we have people talking out against equity in the name of the Lord. So that is a challenge. We've had people create QR codes to show people who they should vote for based on Christian principles. So the things that we've been doing, like I said, we have a lot of town hall meetings. We have our health equity around healthcare meetings, but we also have a racial equity collaborative where we bring community members, and it's multiracial community members. We came up with a countywide racial equity statement, and we've taken that around to all the institutional partners and the nonprofits to see who would like to sign on to that. We were well pleased that there were a lot of people that were willing to sign it, willing to put the statement up in their businesses. Sometimes we have to have other folks go that don't look like me to talk to folks in certain situations, just so knowing your audience and who they will respond to is a strategy that we use. Like I said, we're the only Black-led nonprofit in my county. You know, we show up in a lot of spaces. We always mandate our staff, at least 2 of us go to all civic engagement meetings like city council, school board, town alderman meetings. We try to align ourselves and get on the different boards where these decisions are being made around healthcare and the social determinants of health. Just trying to be present and speak out, and like knowing who your audience is, that's key. So you know who to send to have the conversations.
Very good. Deborah, talk about where you are based in the South. How are you managing the conversations around language? I know everybody's not on the same page, but I'd love to get your perspective around how you're managing it.
It's complicated for all the reasons that we just talked about. But I think a couple of things is, as an organization, it's really important to do some of the things that we've talked about. This has to be board driven, has to be leadership driven. And you have to understand that, yes, the political landscape is out there. It's always been out there in some ways. In healthcare in particular, if you make it be about patient outcomes, the communities you're serving, that should not matter. Because at the end of the day, we have to be about this. And so it's not political. It's not an option. It's about great care. If you are a state leader, you have to be about your citizens getting great health. I don't know anybody that says, you know what, I don't want my citizens to have great outcomes.
Right.
Nobody's going to say that. And if you connect it to your community and your outcomes, and you remove the myth of what everybody thinks that equity is about race. And I'm not saying that's a component, but it's also about economic. It's about poor people. And poor people don't have a color.
Mm-hmm.
They have a bank account and they don't have enough money to get the foods they need. They don't have the jobs that they need. They don't have the education that they need. And I don't know anybody that leads a state that doesn't want their citizens to be educated, that doesn't want them to be able to make a great living, that doesn't want them to be able to remove barriers for people thriving in their community. So I think we have to find common ground, first of all, and remove some of the myths and the barriers that somehow equity is unfair. It's not about fairness. It's about meeting the needs of everybody. I don't know how the word everybody is unfair, right? And I don't live in La La Land. I do understand the politics of it, and I get it. But at the end of the day, in healthcare in particular, we have to come back to meeting the needs of the communities that make up our states. It's just that simple in healthcare. And then we just have to partner with whoever we need to partner with to remove those barriers, because we can't do it alone.
That's an excellent point. As a federally qualified health center, we consider ourselves to be at the heart of the safety net, the healthcare safety net. However, it takes a village. We are so fortunate to partner with our county health department. And they came out several years ago in the local newspaper saying racism is a public health crisis. And we have espoused that view. I have the privilege of working with literally dozens of nonprofit partners and hospitals and others. We understand the issues of the social determinants or social drivers of health, including housing insecurity, food insecurity, clothing insecurity, warming shelters, cooling shelters, all those things that our patients, 77% of the patients we serve are at or below 100% of the federal poverty level, which is $32,100 for a family of 4. We need to be paying attention to that. Do we provide housing? No, but we certainly refer people every day to make sure that they receive the dignity and respect they need and they can get housing. And, you talked about people having a bank account. So many of our patients are unbanked. They don't have enough stability. They're living paycheck to paycheck, literally, it's not only poverty. Sometimes people are working 3 jobs and they're not benefits eligible. They don't have enough hours to be benefits eligible at either one of those 3 jobs. And so they go onto our sliding fee scale, and it's a deeply discounted rate. We just work really hard to make sure that everybody who wants to be seen is seen.
You all make some incredibly salient points around the complexity of being able to navigate these waters in real time as organizations. And I think you've given people some solutions or some things to think about. And I want to stay right on solutions. One of the questions that we got asked was around things that you have done in your organizations or in your communities that have moved the needle on equity. If you could share a little bit of that, that would be very helpful. And Deborah, I'm going to just go ahead and start with you.
Understanding the economic challenges, food deserts are real, housing security, being able to earn a living wage that is above the poverty level, or at least having a mechanism to get you there, and being willing to understand that starts way upstream. We've got to start partnering with our education system. We have workforce development programs for high school students. And in particular, you target high school students that do not have a plan. They don't plan to go to college. They don't know what they want to do. And introduce them healthcare as an option. Not everybody sees the option of a 4-year degree. Well, let's get you a certification, because we need nursing assistants. We need medical assistants that requires 0 college. Let's start in high school, that when you graduate high school, you can get that certification. And oh, by the way, we will remove the barrier. We will pay for it, because we can't get enough of those people. And then when you get the certificate, we will hire you. And when you get hired, you have a pathway that you don't just have to stay an MA if you don't want to. Then we get you into a workforce development program where you can be an LPN in 12 months, and we will pay for it. And we will figure out how to allow you to work part-time and then go to school. We will work with you, because we have a workforce shortage. We need more people to get into healthcare. So why not be able to work on both of those things at the same time?
That's awesome.
We know that part of the health disparities is we do not have enough physicians that look like the patients that they're serving. We just announced 2 weeks ago that we're going to partner with Xavier University to create another HBCU medical school. So, there's a variety of things you can do. It's not just one thing, but you have to recognize that what you can do, you need to try to do. We partner with middle school students. We don't have enough middle school students that identify STEM as important in their education. That has to start really early. And so we partner with elementary schools in our state. So it's a variety of things that you have to think out of the box, way upstream of the problem. Once you see the problem, once you recognize those challenges. I do think having a supplier diversity program that understands that we need to do business with minority, small-owned businesses is really, really important. That economic impact to your state is so important. Removing those barriers for those small minority business owners to be able to come in and work with your organization. It's just trying to address some of the barriers to this in a collaborative way and meeting people where they are, working with our homeless community, working with our mayors to do what we can to be able to meet them where they are. Not everybody has a car to come to you. You have to go to them. We have to meet the needs of our communities.
Very good. First of all, thank you for sharing those contextual ways of how your organization is moving the needle, closing gaps. I want to center back in a little bit around the CEO in particular. That's a very important role. A lot of people coming at them, a lot of responsibility, a lot of accountability around the job. And most importantly, are focused on a lot of different things that may not be equity So I want to ask the question around how do you build trust with an executive, a CEO, who doesn't see this as a top priority, doesn't have it on their radar screen? If you had to name the 5 things that are most important to them when they got up that morning as they run their healthcare organization, equity would not be in the top 5. So what do you do to engage someone at that level? I think it would be helpful for our audience to hear. So I'm gonna start with Donna because I know she's the one who's been fighting this fight and have had a lot of challenges. Let's try to get to some real things that people in other communities could be doing, or some ideas that you would throw out there for people to think about.
So you all have heard me say this multiple times, this relationship building. First, trying to build those relationships, setting up meetings. If you can't come to us, we'll schedule a Zoom call. Making sure you're included on the invites for all of our community events so you can get out and see who's in your communities. And so it's a safe space for everybody to share with each other. And that's basically what we do. We spend a lot of time hitting the pavement, going to have meetings, having coffee with folks, inviting people to meetings, and we always have food. So that removes the barrier, because after you've worked a long day, the last thing you want to do is go to a meeting and you're hungry. So we have food, and just again building authentic, genuine relationships, and knowing that we're not attacking the person, we're trying to attack the problem. And like Miss Deborah said, just finding that common ground. Like she said, poor people come in all colors, as do rich folks. But we all want to be healthy. We all want to have access. And sometimes it is a challenge because people's schedule. So we have to give folks grace. If the first couple of times it doesn't work, you keep trying until you see that persistence is going to pay off, and both can find a mutual benefit in coming together to work towards equity. And like Miss Deborah said, making folks realize that equity is not just about race. That myth is the one that we're trying to bust all the time, that this is not about race. This is not being unfair to one person or another. No one is trying to take anything from anybody. We're trying to make sure everybody gets what they need to live a happy, healthy, thriving life.
Very good. Joe, what would you say? Let's just say you weren't as transformational as you are on equity, and this was day one of your journey. What was helpful for the community or for internal folks in your organizations to do or say to you to help engage you around this issue?
One thing stands out to me very distinctly was the neighborhood in which our federally qualified health center is located. We need to be walkable, bikeable, busable, right? In other words, it's all about access, because not everybody works first shift. And in our neighborhood, there was a couple of years ago, we became partners in an initiative called GVI, or a gun violence intervention, because there were so many incidents of shots fired and kids getting killed in drive-by shootings. And you think, okay, Iowa, that doesn't really happen. Yeah, it really happens. Donna talked about relationships, and Deborah so eloquently talked about the importance of partnerships. And to be a part of that partnership was so important for us. And there were a couple of organizations in town that were real leaders there. And one of them was the Community Foundation. And another was Lincoln County Public Health. And another one was Foundation 2, which is a 24/7 mobile crisis unit. And they became embedded with the police to go on multiple police calls so that they would be able to de-escalate that situation when they get there. It is such a multifaceted problem in so many ways. And yet you just got to kind of tackle it one at a time. And has gun violence been reduced? Yes, dramatically. So this works. And it's getting kids into after school and evening programs. It takes a lot of us working in different ways to make sure that we do actually move the needle and make a difference.
Awesome. Very impactful. Deborah, last word on this is, how do you get a CEO there?
Yeah, I think recognizing that how challenging the CEO's role is. It is a team sport, and sometimes we hold the CEO accountable for everything, rather coming at it from holding a person accountable or a title accountable. Say, hey, the organization needs to invest and address health equity. let's partner together. Just the idea of really partnership and meeting people where they are rather than saying you're wrong and I'm right and why haven't you done it? I just think it's all about the collaborative nature, because you can still have an imperative. You can still have a sense of urgency, but make it be collaborative. That's something that I do feel is really, really important, because people don't run to things that they feel threatened by. Somehow we've made this be too divisive rather than making it be about the betterment of the organization or the betterment of a state or the betterment of a community. I think we have to come at it with more humility sometimes and starting out small. If you think that you have to address all of these issues right out of the gate, it's going to be intimidating. And it's going to be like, there's no way we could do it. I would start with low-hanging fruit. Start with things that no one's going to debate. You know, having great outcomes and access for children, taking care of the elderly, taking care of people with disabilities. That's generally not a place where we go to say that's horrible. I'm a fan of starting somewhere, not ending there, but just starting on some common ground, common sense things, and then building off of those relationships, because it is relationship driven. There's no doubt about it.
Well, we're going to end on that note where we began. This whole conversation is the word relationships, relationship with your community, relationship with the CEO, relationship with the people inside and outside of healthcare is what we want to build at the intersection. So I want to thank Donna, Deborah, and Joe for your time and participating in this great discussion. It's been insightful. I've learned a lot, and I appreciate your work and your help. I want to thank you for listening to the Intersection Podcast. For more information on upcoming events and to join our mailing list, visit us online at meetattheintersection.org.